They laughed at the rookie nurse, until a dying Navy SEAL captain looked at her, lifted his shaking hand, and saluted. What you're about to hear actually happened in a hospital ER, and it will change the way you see the quiet ones forever. Stay until the end, because the final twist will hit you harder than anything you've felt in a long time. 8:11 p.m., St. Haven Memorial Hospital. A SEAL captain lay on the gurney, his arm pale, swollen, and losing blood flow fast. Two surgeons hovered over him, arguing in low, grim voices. "Circulation's gone," one whispered. "We may have to amputate." The captain clenched his jaw until he saw her. A rookie nurse walked in quietly, carrying a tray of medication, young, blonde, soft-spoken, the kind everyone overlooked. The surgeons didn't even pause, but the captain froze. Then, to everyone's shock, he lifted his good hand and saluted her. "Ma'am," he whispered, voice trembling. "You saved me once in Iraq. Don't you dare let them take my arm." The room went silent. She tried to step back. "No, I'm not that person anymore." But the captain locked eyes with her. "Corpsman, please. You're the only one here who knows how to fix this." The surgeon scoffed. "A nurse? This is impossible." She looked at the dying arm, the collapsing artery, the memory she'd buried. Then she said softly, "Give me 3 minutes." And what she did next, no civilian hospital had ever seen before. 8:16 p.m., St. Haven General Hospital. The ER was unusually loud for a Tuesday night. Residents scrambled, nurses rushed, alarms chimed, and stretchers filled every corner of the trauma floor. Nobody noticed the paramedics rolling in yet another patient, until they saw the uniform. A Navy SEAL captain, tall, muscular, jaw clenched, face drained of color. His left arm strapped to his chest with makeshift bandages soaked through with darkening blood. A training accident, they were told. Broken arm with severe blood vessel damage. Possible amputation needed. 2 residents gasped. One whispered, "I've never seen an arm that swollen." The trauma surgeon on call, Dr. Rowan Hale, the region's best, stepped forward with that cold confidence surgeons wear like armor. "Let's get him to Bay 4. Hale ordered. "Prep for surgical amputation. He's losing the limb." The SEAL captain didn't flinch, but his jaw tightened just enough to betray pain. He gripped the stretcher rail, breathing in short, controlled bursts, the way soldiers do when they refuse to show weakness. "He's a fighter," a resident said. "No," Dr. Hale corrected. "He's a man about to lose an arm." They pushed him into Bay 4, curtains half-drawn, fluorescent lights reflecting off metal trays. A nurse read off the vitals, voice shaky. The captain shut his eyes, swallowing hard, his breathing steady but forced. The residents gathered around, excited to witness the surgeon at work. Then the curtain rustled. A young woman stepped in quietly, almost unnoticed. Rookie nurse. Light blonde hair pulled into a low bun. Blue scrubs slightly too big for her. Clipboard tucked into her elbow. Eyes soft, posture timid. A girl everyone ignored. Her name tag read Nurse L. Carter. "What are you doing?" Dr. Hale snapped. "This bay is restricted. We're prepping for surgery." She froze mid-step. I was just asked to bring the injection kit." A few residents chuckled under their breath. "Of course, the rookie is lost," someone muttered. But the SEAL captain opened his eyes at the sound of her voice, and everything in him stopped. He blinked, stared, focused. Then without warning he tried to sit upright, pain tearing across his face, but he forced through it. Even Dr. Hale stepped back from shock as the SEAL captain raised his good arm to his forehead and saluted her. Dead serious. Perfect form. No hesitation. A salute heavy with history. The room fell silent. Even the machines sounded quieter. The rookie nurse's face went pale. "Sir, please don't. You'll hurt yourself." "You!" the SEAL captain breathed, voice cracking. "I knew it. I knew I wasn't imagining it. Carter? Foxglove? Is that really you?" A resident frowned. "Foxglove?" Another whispered. "Is that a call sign?" Nurse Carter stepped back, shaken, her throat closed up, hands trembling just slightly. "I'm not her anymore," she whispered. But the captain wasn't hearing it. His eyes were burning with a mix of pain, respect, and something like gratitude. "You saved my life in Iraq," he said. "Chest wound, ambush en route Anbar. You carried me out when the others—" He swallowed hard. "You got me home." The residents froze. The surgeon's confidence cracked. Even the monitors seemed to pulse slower. Nurse Carter looked away sharply. "Please, I don't do that anymore." Hale coughed, trying to regain control. "Miss Carter, whatever your past is, this is a surgical case. His limb is gone. We're prepping for amputation." Her head snapped toward the scans on the screen, and something in her changed. The timid posture vanished, her eyes sharpened, her breathing steadied. The soft-spoken rookie nurse was replaced by something colder, trained, disciplined. "Why amputate?" she asked quietly. Hale scoffed. "Because the radial artery is collapsed, circulation's gone. Tissue death is minutes away. This is not a nurse-level case." She stepped closer. "But the compartment pressure looks reversible." "It's not." "Yes," she said, voice suddenly steady. "Yes, it is." Hale crossed his arms. "You think you know more than I do?" The SEAL captain exhaled in pain. "Let her try," he said through his teeth. "If anyone can save my arm, she can." Hale spun toward him. "Captain, with all respect, she's a rookie nurse. She's not qualified to." Carter wasn't listening. She leaned over the injured arm, her fingers moving with precision no rookie should have. She pressed along the muscle compartments, analyzing pressure, direction of swelling, mapping the blood vessel collapse with touch alone. "Sir," she said to Hale, "this isn't dead tissue. It's delayed artery spasm with collapse from the trauma. The fragments are compressing the sheath, not cutting it." Hale opened his mouth, then closed it. Residents blinked in confusion. Because none of them had ever heard that terminology used outside battlefield medic tents. "What does that mean?" a resident asked. Carter looked up, calm and certain. "It means we don't amputate." The SEAL captain exhaled in relief, gripping her wrist with gratitude. "I told you," he whispered. "Foxglove always saves her people." "Stop calling me that," she murmured. Hale clenched his jaw. "Even if you're right, no civilian hospital does that kind of stabilization." She hesitated, then quietly said the words that froze the room again. "I do." Hale stared. "You're telling me you know a technique that isn't even legal outside combat zones?" "I'm telling you," she replied softly, "that he'll lose his arm if we wait for you to prep the ore." The SEAL captain nodded, eyes locked on her. "Please," he said, "just try." She closed her eyes for a moment, her breast shook, memories she never wanted resurfacing, blood, dust, her partner dying in her arms, her hands failing him, her voice begging him not to go. But she opened her eyes again, steady, focused. "Fine," she whispered. "I'll do it." The residents stepped back instinctively, as if witnessing something sacred. Carter grabbed the sterile kit, sanitized, gloved up, then positioned herself at the SEAL captain's side. "Pressure the proximal section," she ordered. Hale blinked. "What?" She looked up. "If you want to help," she said evenly, "hold pressure. Now." No one had ever heard her give a command before. Hale obeyed. She worked fast, controlled, confident, hands moving like someone who'd done this 100 times under gunfire. She performed a stabilization release maneuver none of the residents recognized, something taught only in elite combat medic programs. The SEAL captain clenched his jaw, gasping, but then his fingers twitched. Then again. Then slowly blood flow returned. Color crawled back into the hand. A resident whispered, What did she just do?" Hale stared like he was witnessing a miracle. And Nurse Carter stepped back, chest rising and falling, eyes glassy with memory she couldn't escape. "It's done," she whispered. "He's stable." The SEAL captain breathed out in relief, tears forming. "Foxglove, You saved me again. The rookie nurse swallowed hard. I told you, she said quietly. I'm not her anymore. But before anyone could speak, a voice from behind the curtain said, Actually, we need to talk about that. Carter turned slowly and froze, because standing there was someone she never expected to see again. Someone who knew exactly who she used to be, and why she left the military forever. The moment the curtain slid shut behind them, the room changed. The chatter outside faded. The fluorescent lights hummed overhead. The SEAL captain sat upright, cradling his swollen arm, eyes fixed on the rookie nurse like she was a ghost pulled straight out of the desert sand. Emma Hayes kept her gaze on the supply cart instead. She pulled gloves, alcohol wipes, sterile packs, anything to avoid meeting his eyes. Emma, Captain Cole said softly. She froze. He hadn't said her name like a question. He said it like a memory. But she kept prepping the injection tray, pretending not to hear. If she let him speak, let him remember, let him bring the past into this room, everything she had rebuilt in the last 7 years would crack open again. You don't have to do this, she murmured. I'm just here to give the antibiotic injection and leave. He exhaled a slow breath that carried a weight no one in this hospital would ever understand. I know who you are, he whispered. Her hands trembled for the smallest second, but she didn't turn. You shouldn't, she said. That life is gone. Let it stay gone. Behind them, Dr. Kellen stood by the computer, charting notes loudly on purpose, still irritated that a rookie nobody had been allowed inside his trauma bay. He tapped his pen against the desk, glancing at Emma with thinly veiled annoyance. You done yet? He muttered. We need to prep for amputation. The longer you're in here, the more time we waste. Captain Cole's jaw tightened. We're not amputating. You don't get a vote. You're the patient. I'm the surgeon. Emma stepped forward, then slow, quiet, but with that strange calm she always carried. Sir, your patient's perfusion is decreasing. The window is shrinking. Dr. Kellen shot her a glare. Thank you, nurse. I'm aware of my job. But Captain Cole wasn't listening to the surgeon at all. Only to her. Do you remember Fallujah? He asked. Emma's breath caught. She shut her eyes for one heartbeat. Maybe two. The memory wasn't a single picture. It was a flood, shrapnel slicing the air, sandstorms choking the sky, her partner Aaron falling right in front of her, and the sound she could never forget, a gunshot cutting through the heat like a knife. When she opened her eyes again, everything about her face had changed. Yes, she whispered. That was the first moment Dr. Kellen finally looked at her, really looked at her. There was something in her posture he'd never seen from a rookie. Something controlled, trained, military, but he dismissed it just as quickly. Captain, I know you're emotional, but this nurse is not qualified for anything except handing me supplies. Captain Cole lifted his uninjured hands slowly and saluted her. Dr. Kellen's jaw fell open. Nurse Hayes saved my life, Cole said, voice steady. She dragged me half a mile under gunfire with a bullet in my lung. If there's one person in this hospital I trust more than you. His eyes moved to Dr. Kellen, cold and clear. It's her. Emma's heart dropped into her stomach. This was exactly what she feared: recognition, memory, exposure. She kept her voice low. Captain, that was a long time ago. And you're still her, he said. Dr. Kellen slammed his chart shut. Enough. This is absurd. Nurse Hayes, step away from the patient. But Captain Cole didn't let her. Emma, he murmured. Look at my arm. She did. The skin around the bicep was turning a sick shade of purple. The pulse at the wrist was faint, barely there. His hand was already colder than it should have been. Compartment syndrome. Crushing pressure. No blood flow. If they didn't restore circulation in minutes, the arm was gone. What do you see? He asked quietly. Emma swallowed. She saw it all, things no one else in the room would ever recognize. Pressure lockout, she whispered. Vascular choke. Your forearm fasciotomy was done wrong. Dr. Kellen stiffened. Excuse me? Emma didn't back down. The previous cut wasn't deep enough. Blood's trapped. If you amputate now, you'll amputate a salvageable limb. Dr. Kellen scoffed. You're guessing. She isn't, Captain Cole said firmly. Emma shook her head hard. Don't say that. Why not? He challenged. You saved me once. Save me again. Her eyes flickered, not to the surgeon, not to the wound, but to something far away. A face she would never see again. Her partner, the one she couldn't save, the reason she left the military. This is different, she whispered. No, Cole said softly. This is the same. Someone is going to lose their life or their arm unless you step in. And I know you can do it. Her breath shook. Dr. Kellen threw up his hands. This is ridiculous. We don't have time for sentiment. Then something happened he didn't expect. Emma moved. Not fast, not loud, but with purpose. She reached for the sterile kit, tore it open with practiced precision. Her body shifted into that stance, the one only combat medics used when they were seconds away from losing a soldier. Dr. Kellen's face twisted. What do you think you're doing? Emma didn't look at him. Sir, she said calmly, your patient has a collapsing radial pulse, mottling in the fingers, and a vascular block that's seconds from irreversible shutdown. If you amputate now, you'll amputate a limb that can be saved. That's my decision, he barked. No, she said quietly. It's the correct medical decision. Captain Cole watched her with something that wasn't fear anymore. It was respect. Emma placed her fingers gently along his arm, feeling the pulse line. There, she whispered. It's trapped under the fascia. How do you know? Dr. Kellen demanded. She finally looked at him. I've relieved this pressure in the field, twice. Dr. Kellen recoiled. You? In the field? Emma didn't blink. Under fire. The room went silent. Then the surgeon said the one thing she knew he would. I won't authorize it. Emma knew this would happen. She also knew what came next. Captain Cole lifted his chin. I authorize it. You can't. Dr. Kellen sputtered. Cole cut him off. It's my arm, my decision, and I choose her. Emma breathed in slowly, steadying her hands, steadying her heart. No civilian nurse should know this technique, Dr. Kellen said. No civilian nurse does, Cole replied. Emma met the surgeon's eyes finally, openly. Step back, she said softly. Dr. Kellen hesitated. Captain Cole didn't. Do it, Emma. Her fingers tightened around the scalpel. She whispered almost to herself. Please don't make me remember this. But it was too late. Her past was already awake. She made the first incision. Dr. Kellen gasped. No, that's wrong. Emma didn't stop. She opened the fascia along the trapped vessel, the combat medic way, defying every civilian protocol in the book. For 4 seconds, nothing happened. Then blood flow surged. Color returned to the hand. Captain Cole exhaled, relief crashing through him like a wave. Emma stepped back, shaking. The room was silent. Dr. Kellen's face went pale. Captain Cole whispered one word. Valkyrie. Emma turned away instantly. I'm not her anymore. But her voice cracked. Dr. Kellen stared between them, stunned. Who are you? Emma didn't answer. She walked toward the door, slow, silent, leaving the room in absolute disbelief. But before she reached it, a voice behind her stopped her cold. Wait. She froze. Captain Cole said softly. Emma, there's something I need to tell you. Her blood ran cold. And when she turned around, he wasn't looking at her wound or the tray or the surgeon. He was looking at her with something deeper, something dangerous, something she wasn't ready to face. It's about Iraq, he whispered. And the day you think you failed. Emma's chest tightened, her fingers curled into fists. The past she tried to bury wasn't done with her. Not even close. The surgical team dispersed across the hallway like a tide retreating after a storm, carrying tablets, forms, and concerns that seemed to echo through every corner of the orthopedic wing. But Ava remained still. She leaned against the wall outside Recovery Bay 4, staring at the floor tiles with the same expression she had worn in Iraq the night everything changed, calm on the surface, but cracked underneath. Only now she wasn't holding a rifle. She was holding a clipboard. Inside the room, Captain Cole Harrison rested with his arm finally wrapped, stabilized, and saved by her. The very thing the surgeon wanted to cut off, she brought back with a maneuver no civilian medic would ever dare attempt. The attending physicians left the room whispering to themselves, trying to piece together how a nurse, a rookie one, reversed something they had already declared hopeless. Dr. Vargas. The senior trauma surgeon walked past her, pausing only long enough to avoid eye contact. You went beyond your role today, he muttered. She nodded. Yes, sir. He hesitated, something uncharacteristic for him. But you also saved his arm, and maybe his career. Then he left. She exhaled shakily, pressing her thumb against the spot where her ID badge hung. She expected reprimand or praise or anything, but mostly she expected silence. That was what she was used to. That was what she'd accepted. A quiet nurse in a loud world. The door opened. Captain Harrison stepped out, still in his hospital gown, slings supporting the arm she'd restored. His other hand rested against the door frame as he steadied himself. Ava, he said softly. She froze for the first time all night. His voice wasn't the voice of a patient. It wasn't the voice of a stranger. It was the voice of a man who had once laid dying on a dirt floor beside her. Don't, she whispered. Not here. But he didn't move closer. He only studied her face the same way he had in Iraq, blood pooling under them both, dust clinging to their uniforms, and her hands trying desperately to keep him alive after a sniper round tore through his chest plate. You still wear the dog tag? He asked. Her jaw tightened. How long have you known? She deflected. Since you walked in, he said. His good hand lifted into a perfect salute, slow, deliberate, deeply respectful. The same salute he had given her back then when he woke up in a field hospital with her at his side. She didn't return it. She couldn't. Her throat clenched too tightly. A passing nurse gasped softly, stopping mid-step as she realized what she was witnessing, a Navy SEAL captain saluting a rookie nurse. A doctor peeked around the corner. A respiratory tech froze with a cart. Even a janitor paused with his mop halfway across the floor. The hallway seemed to hold its breath. Ava, he said again, lowering his arm. You saved my life today. Again. She stared straight past him into the empty waiting area. You should rest, Ava. His voice gentled. I remember more than you think. Her fingers trembled around the clipboard. The first twist came quietly. Your partner, he said. The one you lost, he was my radio operator. You never knew I saw it happen. Ava's eyes snapped shut. No one ever mentioned that day aloud. Not in 3 years. Not in therapy. Not in civilian life. Not even in her own mind. She tried to bury it under shifts, routines, new uniforms, and new identities. Harrison shifted his weight. You're running, he said. But you don't have to anymore. She opened her eyes. Stop, she whispered, but there was no anger, just fear. He stepped closer, careful not to touch her. You saved my life then. You saved my arm today. And I still haven't thanked you for either. You thanked me, she said, her voice barely a breath. You saluted me before they took you away for evac. He shook his head. That wasn't a thank you. That was respect. He swallowed. A thank you is different. In the silence that followed, the fluorescent lights buzzed softly overhead. The night shift was beginning, and the hospital's energy shifted, quieter, slower, dimmer. Ava, he murmured. You didn't lose your partner because you failed him. You lost him because war is cruel and random. You saved everyone you could. Her heartbeat punched against her ribs. She stepped sideways, gripping the wall rail. You don't understand, she said. I froze. You didn't freeze. He said it with absolute conviction. You carried 2 men out after that. You dragged me across a courtyard under fire with your leg bleeding. You shielded me until extraction arrived. That's not freezing. She shook her head, tears threatening but not falling. Stop talking like you were there. I was, he said gently. Pain flickered across her face, deep, sharp, raw. She turned away, walking toward the quiet end of the corridor where no one else cared enough to follow. Harrison stayed a few steps behind her, giving her distance but not letting her drown alone. Look at me, he said softly. She didn't. When you left, he continued, I understood why. But running from who you were doesn't make the past go away. She stopped walking. If you keep burying it, he said, you're going to lose yourself. A long, trembling silence filled the empty hallway. Finally, she turned, just barely, just enough for him to see her eyes. What if I already have? She whispered. He inhaled sharply because that was the second twist. That was the real wound. Not the war, not the partner, not the discharge. It was the belief that she didn't deserve to still be here. Ava. His voice cracked. You saved me again today. Not because you're lucky, not because you stumbled into the room, but because you're who you've always been. You are the best combat medic I have ever seen. She squeezed her eyes shut, trying to force the tears back. You think the doctors didn't notice? He asked. You think they don't know you're something extraordinary? They'll fire me, she whispered. They'll figure out I'm not supposed to be here. You belong here, he said. Maybe more than any of them. She shook her head. No, I'm trying to be someone else now. Ava, he murmured. You can't be someone else. You're you. Her breast shuddered. Just go rest, she pleaded. Please. His expression softened. I will, but not before I tell you this. He stepped forward slowly until he was close enough for her to see the earnestness in his eyes. You didn't fail your partner. Her fingers froze. He didn't die because of you. The third twist came like a quiet detonation. Harrison whispered. He died saving you. The hallway spun around her. Her knees nearly buckled. Her partner hadn't died because she couldn't save him. He died to save her. She couldn't breathe, couldn't speak. A nurse at the end of the hallway glanced over, sensing something was wrong, but didn't interrupt. Harrison reached out with his good hand but didn't touch her. He just waited. You didn't know, he said softly. And that's why you've punished yourself? Her voice was barely a tremor. Why didn't anyone tell me? Harrison's expression turned sorrowful. Because sometimes the truth hurts more than the lie, and they thought they were protecting you. She stared at him, shattered, shaken, unraveling. He lowered his voice. You deserve the truth, and you deserve peace. Something inside her splintered, not breaking, but opening. She managed to whisper. I don't know who I am anymore. Harrison exhaled. That's the part we figure out together. Before she could respond, a sudden chime echoed overhead. Code Blue, Recovery Bay 4. Harrison's eyes widened. That's my room. Ava spun toward the hallway. The captain's monitor, the one she stabilized earlier, had just flatlined. Ava sprinted down the hallway, her shoes slamming against the polished hospital floor, the overhead lights streaking above her like the memory of a battlefield she never wanted to remember again. Nurses parted instinctively. Residents stumbled out of her way. Even orderlies froze as she shot past them like a bolt of controlled lightning. Recovery Bay 4. Harrison's room. The same man who minutes ago told her she deserved peace. The same man whose life she'd pulled back from the brink with nothing but instinct, scars, and a technique she hadn't used since Iraq. She reached the doorway, and the sound hit her first, the piercing high-pitched drone of a flatline, a monotone scream, a death sentence. Ava shoved the curtain aside. 2 residents were already there, fumbling over his body, trying to push meds, trying to adjust pads, trying to revive him, trying and failing. Ava, don't, one of them snapped. But she wasn't listening. She was already beside Harrison, fingers on his neck, registering the faintest warmth, the slightest hint of lingering electrical activity under the skin. Not a pulse, not life, a chance. A single chance, one she refused to waste. She reached over the panicking resident, grabbed the defibrillator paddles, and adjusted their angle just a few degrees, but degrees that mattered. "Clear?" she murmured. They stared. "Nurse, you can't." "Hit it," she commanded. The shock fired. Harrison's chest jerked, but the monitor stayed flat. One of the residents swallowed hard. "Call it." Ava didn't blink. "No." Her voice was low, calm, unshakable, the voice she used the night she held a Marine's artery closed under fire while mortar rounds crushed the valley around them. She adjusted the pads again. This time she reached beneath the bed, lifted his arm, repositioned it slightly to change the conduction path of the impulse, something only combat medics learned, something no civilian textbook ever mentioned. She nodded to the resident again. "Again, ma'am." "Again." The shock hit. A second jolt, and then a flicker on the screen. Just a flicker. The smallest blip of electrical defiance. Ava leaned closer, inches from his face, as if her proximity alone could anchor him back to the world. "Come on, Captain," she whispered. "I didn't save you once just to lose you now." Another blip. Then two. Then a rhythm, weak, fragile, a newborn heartbeat trembling its way back into existence. The room went silent. Residents stared at her, as if she just bent the laws of medicine with her bare hands. "Ava," one whispered. "How did you?" She didn't answer. She didn't have to. She took a shaky breath, her chest rising with something that felt too big, too heavy, too long buried. Harrison's eyes opened only for a second. But in that second he looked at her like she was the only steady thing in the world. Like he knew she'd saved him twice now. Like some part of him remembered Iraq, remembered her voice screaming his name through dust and blood and chaos, remembered her dragging him out of a kill zone with shrapnel in her own leg. His lips parted. A rasp. "Ava!" But the effort pulled him back under, and his eyelids slid shut again, this time peacefully, not painfully. Ava clenched a trembling hand against her chest. Every breath she took burned. Every instinct told her to collapse. Every memory told her to run. Instead, she stood there, still alive, watching the heartbeat she rescued pulse steadily across the monitor. She didn't notice the surgeon behind her. Didn't hear the soft footsteps. Didn't feel the hand hovering at her shoulder until he spoke, very softly, very honestly. "You didn't just save my son," he whispered. "You saved me." Her eyes stung, her throat closed. For years she carried shame like armor. Now someone handed her something different, something she wasn't sure she deserved. Recognition, gratitude, a place she belonged. And when she finally turned toward him, her voice cracked. "Why do people keep thanking me for surviving?" she whispered. "Because survival," he said gently, "is an act of courage, too." Ava looked back at the monitor, at Harrison's heartbeat growing stronger, and something inside her shifted. Not healed, but no longer hiding.